Hello friends, this is the third lecture of our male reproductive system. We are going to discuss about the male sex hormone. So let's get started. The testes secrete male sex hormone. They are called androgen. Now what is androgen? And by definition, androgen means that any steroid hormone that has a musculizing effect, including testosterone, it is known as androgen. Right? Now what is musculizing means? Right? Musculizing means masculine in nature or in appearance. Got it? So what are the list of the androgen? So first thing is the testosterone, then the active form of testosterone is the dihydrotestosterone, and the androgen next one is the androstenedione. Right? Out of that, testosterone is in more abundant and it is formed by, as you guys already know, from the interstitial cell of a lady or Leydig cell. Now let's see about testosterone. Let me give you a clear picture of a histological slide of having a test of testes. See, in this slide there are two compartments that are you already know. This one is the tubular compartment. This one is the single seminiferous tubule. It is known as tubular compartment. It has a Sertoli cell and germ cell along with it. This one is the lumen, and the basal portion of a tubular cell has a germ cell spermatogonia, and they redivide and make a mature sperm, and it is finally released inside the lumen. Right? The area between these two lumen, it is known as paratubular area or intertubular area. Right? So let me show you a picture of it. See, this is the cross section and these are the three seminiferous tubules. So these are the intratubular compartment, and the rest of the portion that is present in between the tubule, it is known as paratubular compartment. Now inside this paratubular compartment, it has a Leydig cell like this. This L stands for Leydig. Right? So Leydig cell basically that present in a newborn, they secrete testosterone, and it basically absent after that. During the childhood, it secrete no testosterone, and again it present after puberty and it secrete testosterone. Okay, now let's discuss the correct chemical nature of a testosterone. As far as the chemistry is concerned, as you guys see from this diagram, it has a 19th carbon steroid, right? This one is the 19th carbon steroid. What changes that we actually made in the cholesterol molecule? First changes that we made is we cut the 20 and 22 bond. It is 22 liase or desmolase. Then we again cut one more bond, that is between the 17th and 20th carbon, right, by 1720 liase, and hydroxylase at a 17th carbon, and the next one is the dehydrogenase at carbon number 3. These are the chemical changes that we make in a cholesterol molecule. Now as far as the transport of testosterone is concerned, 99% is in the bound form. Out of that, 65% with the SBG, that SBG means sex binding globulin, and 33% is the albumin. Now the reverse is actually true for the estrogen. 65 or 70% is bind with the albumin, remaining with the sex hormone binding globulin. And metabolism is, as far as the metabolism is concerned, it is basically androsterone and the estrogen. The testosterone is eventually converted into the estrogen by aromatase enzyme. Now androsterone is 17 keto steroid. What actually happens in androsterone? Again there is dehydrogenation at this level, and it make a double bond over here, and because of this double bond present over the 17th carbon, it is known as 17 ketosterone. It is androsterone. Now synthesis of a testosterone. As far as the synthesis of any steroid hormone is concerned, we already go through in a very good detail in synthesis of a steroid hormone. So you already know how the androsterone is synthesized. So these are nothing but a revision of that particular lecture. Inside the Leydig cell, first cholesterol molecule converted into the pregnenolone by desmolase enzyme, that is 22 lyase, right? This one is the pregnenolone molecule. In this pregnenolone molecule, this 3 beta hydroxysteroid dehydrogenase dehydrogenation take place. This dehydrogenation is take place at third carbon. This 3 stands for the number of the carbon. So this one is the third carbon. So dehydrogenase will remove the H and it converted into this kind of molecule. That molecule is known as progesterone. Now this is the progesterone molecule. It has a 22 carbon attached to it. This one is 19. This one is 20. 20 and 21, right? So in this progesterone is 21 carbon atom, same as pregnenolone. Now what happens? There is a 17 hydroxylation enzyme will work over this molecule and make a hydroxylation at the 17th carbon. It makes 17 hydroxyprogesterone. After that, what happens? There is a lysis of this carbon chain occur, the bond between 17th and 20th carbon. It is known as 17-20 lyase. It's also the function of the 17 hydroxylase enzyme. It is a dual function. It is also known as a dual enzyme. So this bond will be detached and this converted into double bond O, right? That is known as androstenedione. Now how androstenedione will convert it into the testosterone? This is the new thing to you. Now inside this androstenedione, this is a type 3 17 beta hydroxysteroid dehydrogenase will take enzyme will occur and will work and it make OH bond over here. It make a testosterone. So only difference between androstenedione and testosterone is at the 17th carbon is hydroxyl group present. In the androstenedione there is a keto group is present. This group is known as keto group. Got it? Now let's see the action of the testosterone. Now as far as the function of the testosterone is concerned, it has a two type of function, one during fetal life, another one is after puberty. What it actually do during the fetal life? In fetal life it is basically responsible for sexual differentiation and the descent of the testis. Now what is sexual differentiation? Sexual differentiation is means the differentiation to form male external genitalia. Right? After puberty is basically responsible for the secondary sexual characters that we discuss in our subsequent slide. Now as far as the sexual differentiation is concerned, what it will do is causes formation of the external genitalia. It is responsible for the formation of the external genitalia, that is penis and scrotum. These two are the external genitalia of a male. It is also responsible for the formation of internal genitalia indirectly by forming the dihydrotestosterone, the active form of the testosterone. Now what is internal genitalia? There are list of the things that we discuss in testis anatomy: epididymis, vas deferens, seminal vesicle and prostate. These are the internal genitalia. Now how sexual differentiation occur? So initially Wolffian and Mullerian duct are present in both the fetuses, male as well as in female. So any fetus has a two type of duct. One is Wolffian duct, another one is Mullerian duct. Both are present. Now in order to develop a male, or the male development, is required the presence of three hormones. Remember these three hormones. One is the testosterone, another one is the active form of the testosterone, that is dihydrotestosterone, and third one is the Mullerian inhibiting factor, MIF. It is also known as AMH, anti-Mullerian hormone. Both are the thing, MIH or AMH, both are the thing, same thing. Now how this male development will be take place? What trigger the male development? That triggering factor is the male fetus has a Y chromosome, right? That Y chromosome is absent in female fetus, obviously. Inside this Y chromosome there is a very specific region that is in the short arm of located in the short arm. That Y chromosome has a sex determining region, that is SRY. Now what is this SRY? This sex determining region is actually the transcription factor. This transcription factor is basically responsible for increase the production of the hormone that we mentioned, that is testosterone, dihydrotestosterone and Mullerian inhibiting factor. So sex determining region that is present over the Y chromosome is basically the triggering factor for formation of a male, right? So if there is no SRY, then there is no any transcription of the SRY gene, and there is no production of the any hormone. So if there is no hormonal input, then the female structure develop. Got it? So internal settings of all the fetus is to make a female. Got it? The factory reset that is given in the mobile, right? Factory reset of every child, every fetus is to become a female. But in order to make a male, there is one triggering factor that is present due to the presence of the Y chromosome. If the Y chromosome is there, then and then male will be formed. If Y chromosome is absent, then female is formed, no matter how, no matter the consequences, right? So female development is a factory reset of a child, right? If there is absence of the Y chromosome or absence of the SRY in somehow, if the hormone are not formed, then female will be formed. Got it? Now how these changes will take place? Now as far as the sexual differentiation is concerned, this HCG, this human chorionic gonadotropin plus LH, this both has a more or less same effect, will work on a fetal Sertoli cell. Now this fetal Sertoli cell or the male fetal Sertoli cell will form MIF. What is MIF? Mullerian inhibiting factor or anti-Mullerian hormone. Once the Sertoli cell will secrete MIF, that MIF will regress the Mullerian duct. Now from the Mullerian duct, female internal genitalia will be developed. So regression of the Mullerian duct will leads to absence of the female internal genitalia. So there are two type of duct that we mentioned in our previous slide. This Mullerian duct is going to make a internal genitalia of female, and the Wolffian duct will make a male internal genitalia, right? So in order to differentiate into the male, we have to regress the Mullerian duct and we have to stimulate the Wolffian duct. So this is about the regression of the Mullerian duct. Now how the Wolffian duct gets stimulated? Again the same hormone HCG and LH will stimulate the fetal Leydig cell, again male fetal Leydig cell. It will secrete the testosterone, and this testosterone itself is a stimulating factor for development of the Wolffian duct. Got it? So once the testosterone is secreted in the male fetus, it will stimulate the Wolffian duct, and this Wolffian duct is ultimately make a male internal genitalia, that is epididymis, vas deferens, seminal vesicle and prostate. Now this is about the internal genitalia. What about the penis and scrotum? What about the external genitalia? So in order to make external genitalia, testosterone will be converted into the dihydrotestosterone by the enzyme 5-alpha reductase. So 5-alpha reductase will work over the testosterone and make dihydrotestosterone, and this dihydrotestosterone will differentiate the two structure, urogenital sinus and genital organs, and make a male external genitalia. Got it? This is all about the sex differentiation. Now see, if the Y chromosome is absent, if the fetus is female, then no more synthesis of SRY gene related transcription. So there is absence of all these three hormones, MIF, testosterone and dihydrotestosterone. So if there is no MIF, then the regression of the Mullerian duct will not form, and Mullerian duct will eventually make a female internal genitalia. If there is no testosterone, then Wolffian duct is not stimulated, it is rather regress. And if there is no dihydrotestosterone, so the male external genitalia will not be formed. It is as simple, right? So all the fetus has a tendency to develop female internal and external genitalia if there is an absence of the stimulating factors like MIF, testosterone and dihydrotestosterone. This is about the function of the testosterone inside a fetal life. Now what is the function of the testosterone after puberty? That is formation of the secondary sexual character. So first we enumerate the secondary sexual character. The changes take place in the internal genitalia, changes will take place in the external and internal genitalia. Then changes in the voice, changes in the hair growth, then there are some changes that is take place at the mental level, then changes in the body configuration, and finally changes that is take place in the skin. So let's see one by one. External genitalia. As far as the external genitalia is concerned, you have to remember two things. One is penis, another one is scrotum. So what testosterone will do? Testosterone will increase the length and width of a penis, and as far as the scrotum is concerned, it increases the pigmentation and rugosity. Now internal genitalia, it causes the seminal vesicle to get enlarged and secrete its secretion, seminal fluid, and prostate and bulbourethral vein it become enlarged and secrete their secretion. Now what changes will take place in the voice? Voice become masculine, hypertrophy of a laryngeal mucosa occur obviously, and enlargement of the larynx. So at the level after the puberty, because of the testosterone, the voice of a child, if it is a male child, then it is changed to the masculine voice. What would happen to the hair growth? As you guys see, beard start appearing, beard appears, pubic hair. Now this is the difference than the female. Pubic hair is basically triangle with apex up pattern. Now what is apex up pattern? So as far as the pubic hair is concerned, the pattern is different in male and in female. Let me show you the pattern. See, in male there is a triangle having apex up. In female there is a triangle that is apex down. So testosterone will lead to changes in the formation of a pattern of a pubic hair. It causes apex up pattern. Then increase general body hair. Yes, like Anil Kapoor, it increase general body hair. And male pattern baldness. Yes, Jason Statham is basically male pattern baldness. Now let's see what changes will take place in the mental level. The person become more aggressive and interest in the opposite sex will be developed. What will be changes in the body configuration? Shoulder become broaden and typical male pelvis is appear. What is male pelvis? We discuss later. Now muscular growth will be appear. Person become more muscular. As far as the skin is concerned, it is basically increase the thickness of a skin, increase secretion of the sebaceous gland, and that increased secretion of the sebaceous gland will ultimately leads to the acne. Yes, the acne that you see in the male in the boys, it is basically because of the testosterone. So acne is the most common feature in the male adolescent when the body is first becoming introduced to increased level of testosterone. Now after several years of the testosterone secretion, skin is actually normally adapt to the testosterone in a way that it allows it to overcome the acne. So in the early adulthood or in early young age of a male, acne will be present, but after several years acne will be not happens because of the our body become adapt to the more secretion of the testosterone. Metabolic effect of the testosterone. The protein, it is a protein anabolic effect. It causes increased synthesis of the protein and decreased breakdown of a protein. It will lead to protein anabolism. It again increase the rate of growth, increase musculature after the puberty. It causes musculature after puberty. So if you inject synthetic androgen to a person, it will improve the muscle strength. Alright, that's why testosterone is also known as a youth hormone. This thing may be asked in a comment. Youth hormone, testosterone is a youth hormone. So you should write it down in the same session that testosterone will lead to protein anabolic effect. It will lead to increased musculature after the puberty, or testosterone will lead to more amount of the muscle development, is increase the muscle strength. So in order to improve the muscle strength, athlete will use a synthetic androgen that is known as youth hormone. Now the effect over the electrolytes. So as far as the effect on electrolytes is concerned, the testosterone is also a steroid. So it has more or less small amount of action as same as mineralocorticoid in the minor amount. So what is the action of the mineralocorticoid again? It is increase reabsorption of a sodium. Now effect over the RBC. What is the effect on RBC? Is basically increase RBC count. How? testosterone basically does not appear directly stimulate the development of the red blood cell, but it is indirectly increase the erythropoietin level. Got it? So testosterone will increase erythropoietin. That's why hematocrit is higher in male as compared to the female. Now effect on bone. Now as far as the bone is concerned, bone has a two portion. One is the bone matrix, another one is the calcium salt, the organic and inorganic component of the bone. Now testosterone will increase both, so increase bone growth, and it will lead to specific effect on a pelvis. I mentioned in the secondary sexual character, it make a very specific pelvis for male. That specific pelvis is known as a funnel like shape of a pelvis. Now what is this funnel like shape of a pelvis? Let me show you on a diagram. This red color portion is the male pelvis, and just pelvis that beside the male pelvis is the female pelvis. This one is the male pelvis, this one is the female pelvis. You can easily notify the changes that is taking place in between these two pelvis, right? This one is wider, this one is broader and narrow, right? So let's enumerate the changes. Male pelvis is basically very narrow, length of a pelvis will increase and increase the strength of an entire pelvis for load bearing. And funnel like shape is basically present in female. It is also known as ovoid shape of pelvis. Now the mechanism of the action of the testosterone. Now as far as the mechanism of action of a testosterone is concerned, again testosterone is a steroid hormone, so it is basically act via diffusing inside the cell membrane, inside the cell. So its receptor is actually present inside the cell, present over the cytoplasm. So you need to write it down, all the things that you remember in the intracytoplasmic receptor that we discuss in our receptor and signaling. Let's revise a bit. So testosterone will diffuse to the target cell. Inside the target cell, testosterone is converted into dihydrotestosterone. This dihydrotestosterone will bind with the cytoplasmic receptor, then make a receptor hormone complex. This hormone receptor complex will diffuse inside the nucleus. Inside the nucleus, it will bind with the hormone responsive element. This hormone responsive element will ultimately leads to increased formation of a related transcription factor. This transcription factor will leads to formation of the mRNA. That mRNA will ultimately leads to the increased protein synthesis. And these are the event, you have to write it down, the effect of a testosterone. Right? Now feedback regulation. Feedback regulation again is nothing new. Hypothalamus will secrete GnRH. Can you remember the nuclei of hypothalamus that secrete GnRH? We already discussed in anterior pituitary, right? It is medial preoptic nuclei. Medial preoptic nuclei will eventually secrete GnRH. That GnRH will go to the anterior pituitary. It will stimulate the secretion of LH and FSH. Now what LH do and what FSH do? LH will stimulate the Leydig cell. That Leydig cell will eventually increase the secretion of the testosterone. What FSH do? FSH will stimulate the Sertoli cell, and the Sertoli cell will stimulate the spermatogenesis along with secretion of inhibin. That inhibin is basically inhibin B. Got it? Now as far as the negative feedback inhibition is concerned, the inhibin will ultimately causes negative inhibition to the FSH secretion, and testosterone will give a negative feedback inhibition to the LH secretion, right? And one more thing I would like to highlight in this diagram, that the GnRH secretion is again, it is a pulsatile release. If you infuse GnRH in a continuous dose, then its stimulatory effect on the anterior pituitary will be not seen. So there are less amount of LH and FSH secretion, and ultimately less amount of testosterone secretion and less amount of spermatogenesis. So in order to stimulate the testis, we have to give GnRH in pulsatile form. Alright. And testosterone also has an inhibitor effect on GnRH as well. Now this is all about the feedback regulation. Now what about the applied aspect? Let's see the gonadal dysfunction. Now consequences of a deficiency of the testosterone will depend on the age of the onset. You see, testosterone has some function in the fetal life, testosterone has some function in the puberty level, right? So where actually the deficiency of the testosterone will take place, that will determine the actual consequences of the dysfunction, right? So first is the second and third month of a pregnancy, then in the third trimester of a pregnancy, then during the puberty and after the puberty. So if there is a deficiency will take place in early life or early fetal life in second or third month of the pregnancy, then there is a ambiguity in the male genitalia. Now what is ambiguity? Ambiguity is basically the reduce the actually the एम्बिग्यूटी का मतलब होता है कि वो स्पष्ट नहीं होता है. Ambiguity of the male genitalia means that we cannot identify that it is a male genitalia. It is not clear, right? Ambiguity means it is not clear. So if the deficiency will be happens in the early pregnancy, then male genitalia will not become clear, right? The development is not that much of clear. In third trimester, in the late half of a pregnancy, then the testis is already formed, right? The problem is in descent of a testis. So problem is basically in the descent of a testis. This condition is known as cryptorchidism, right? So what is cryptorchidism? Cryptorchidism is the problem in the testicular descent. Now in puberty, what happens when the testosterone is deficient in the puberty? Then the poor sexual secondary character, the poor secondary sexual character and unichoid feature. Now what is unichoid feature? Now unichoid feature is basically reduced or intermediate sexual characteristic. By definition, unichoid means, again ambiguity is more or less like unichoid. It is reduced or intermediate sexual characteristic. Ambiguity means it is not clear. So in broad term both are the same. Ambiguity, it is not cleared, and in unichoid it is a intermediate or reduced sexual characteristic. Now if the testosterone will lost after the puberty, then the secondary sexual character will be appeared, but there is a loss of libido. The person will have a less interest in sexual intercourse, erectile dysfunction, the penis will not get erected, and infertility. Got it? Now let's discuss the cryptorchidism. What is cryptorchidism? Is basically testes fail to descend from abdomen into the scrotum. So basically the testis will be formed at the in the abdominal cavity. So during the fetal development, testis will be developed inside the abdominal cavity, and it normally migrate into the scrotum. So basically it is synthesized or it is developed over here, and this testicular descent through the inguinal canal reach to the scrotum. So it depends on this descent is depend on two things. One thing is MIS, that is Mullerian inhibiting substance, and another thing is the testosterone. So if descent does not happens, then the testis will remain inside the abdominal cavity. So if the testis is remain inside the abdominal cavity, it is exposed to the higher amount of core temperature, right? So as we discussed that the spermatogenesis is basically prone to temperature, right? If the temperature is more, then the spermatogenesis will decrease. So person that having cryptorchidism basically has a less amount of spermatogenesis or rather absent spermatogenesis. Now let's see what happens in male hypogonadism. Again, clinical picture will be depends on whether testicular development deficiency develops. It is because before puberty or after puberty, right? So if it is due to the testicular disease, this testicular deficiency is basically due to the testicular disease. The problem lies in the testis. Then there is increased circulating gonadotropin. That condition is known as hypergonadotropic hypogonadism. Remember that. If the problem lies within the testis, there is a problem in the testis, then there are more amount of the GnRH secretion to stimulate the testis. So that condition is known as hypergonadotropic hypogonadism. Now if the testis lies in the pituitary or the hypothalamus, then there is decreased circulating gonadotropin. That condition is known as hypogonadotropic hypogonadism, right? GnRH is not actually secreting in a pulsatile manner in a enough amount, so it does not stimulate the testis anymore and causes male hypogonadism. That particular thing is known as Kalman syndrome. Now I already told you about the Kalman syndrome in the pituitary lecture, right? What is the Kalman syndrome? In the Kalman syndrome, there is a deficiency of the migration of the GnRH nucleus that is actually present during development inside the nasal area, right? So in Kalman syndrome, there is a delayed or absent puberty because of the GnRH lost its function, and impaired sense of the smell because of the problem in the odorant receptor or odorant nerve that is present inside the nose, right? So what is the actual deficiency lies in the Kalman syndrome? So there is one gene. I already discussed the Kalman syndrome in very detail in pituitary lecture. In Kalman syndrome, there is a gene known as KL gene that is deficient. So normally what happens, the GnRH is actually the neurons, the set of a neuron that is actually formed inside the nasal cavity, and during the development the cell will migrate from the nasal cavity to the hypothalamus and eventually reside inside the medial perioptic nuclei, right? And if it is present inside the medial perioptic nuclei, then it will release the GnRH. So in deficiency of this KAL gene, no more migration of the GnRH will take place from the nasal cavity to the hypothalamus. So ultimately, no more GnRH secreting neuron is actually present inside the medial perioptic nuclei. So no more GnRH secretion at the time of the puberty. So development of the testis will be deficient, and spermatogenesis is deficient, secretion of the testosterone is deficient, and ultimately hypogonadism occur. Now what happens if this deficiency of the testosterone is present before puberty? So if the removal of the testis is actually happens before puberty, then the eunuchidism occur, that is incomplete or less clear sexual differentiation. So no testis, it will lead to permanent sterility. The person is not able to synthesize sperm in enough amount because there is no testis, and the development of the external genitalia will decrease if the loss of testosterone or loss of testis appear before puberty. So decreased development of the external genitalia, this is penis and scrotum, and it also decrease in the internal genitalia. The growth of a seminal vesicle and prostate gland will also be reduced. Again, decrease secondary sexual character, abnormal bone growth, basically increase height, because testosterone is basically responsible for the fusion of the epiphysis. So if there is no more testosterone, so the person height will be increased more and more. So increase height due to delayed union of epiphysis, and ultimately bone is also become weak and thin. If the loss of a testis occur after puberty, then what happens? After puberty, as far as the sexual organ is concerned, they are basically regress slightly in size. No, because they are already formed at the time of the puberty. So regression is very slight. Then the voice slightly regress from the base quality, and there is a loss of masculine hair production, and thick bone will be seen. Decreased sexual desire, but the sexual desire is not actually lost. Erection can still occur, but ejaculation will take place very rarely. So after puberty, if a person lost the testis, erection is there, but ejaculation is not happens, right? So when a man is castrated, the castrated means removal of the testis. If the man is castrated, some of the male secondary sexual character is revert. Which are the characteristics that is revert? That is sexual organ size, voice, then ejaculation, sexual desire are revert. Now one more thing that is given in Ganon in recent edition, that syndrome is known as Fröhlich syndrome. Now what is this Fröhlich syndrome? It is basically a genetic defect in hypothalamus. Remember the term, it is a genetic defect in hypothalamus that is unable to secrete GnRH. It is not same as Kalman syndrome. It is genetic defect that is present, there is inability to secrete GnRH. So abnormality of a feeding center as well, there is abnormality of a feeding center as well. So person causing person to eat very greatly, so the satiety center will not be stimulated, causing person to eat very greatly. So obesity will be appear along with the eunuchism or eunuchism, right? Obesity is seen because of the abnormal feeding center. It is also known as a hypothalamic eunuchism or adipose-genital syndrome, right? Person become adipose and there is a defect in genital development, so basically it is also known as adipose-genital syndrome. It is a new thing that is given in a GANON. And the importance, what is importance? It is not important, it is importance. What is importance? Importance basically inability of a man to develop or to maintain an erection for a sufficient rigidity for satisfactory sexual intercourse. Again, the definition of the importance is like that: inability of a man to develop or to maintain an erection of a penis for a sufficient rigidity for a satisfactory sexual intercourse, right? So what are the causes of the impotence? First thing, the nervous stimulation that is required for erection, that is parasympathetic nerve, right? Erection is basically the function of the parasympathetic, and the ejection and emission is basically the function of the sympathetic. So in order to develop a proper erection, we need proper parasympathetic nerve supply. So there is a trauma to the parasympathetic nerve supply, it will lead to impotence. Deficiency of the testosterone and certain drugs, alcohol like nicotine, alcohol and antidepressant. So person having nicotine or person taking alcohol or person taking antidepressant have a impotence. There are chances of impotence. And the last one is the vascular disease, and this impotence is successfully treated with the phosphodiesterase 5 inhibitor that is known as sildenafil, Viagra. We already discussed in how the erection will take place, right? So this is all about the male reproductive system. Thank you.